Hello, and welcome to Chapter 11 in this course dealing with topics in implementation research. In this chapter, we explore the importance of sustainability and sustainment in implementation research. These concepts are essential for ensuring the long-term success of implementation research projects. By the end of this chapter, you will be able to describe the concept of sustainability, or sustainment, as well as the importance and rationale of integrating sustainability as a concept into implementation research design. We will also discuss how to select appropriate study designs for implementation research questions and examine various frameworks that define sustainability and sustainment. By utilizing relevant frameworks, we can assess key implementation outcomes such as fidelity and adoption in post-implementation studies. Let's start with the concept of sustainability, or sustainment. Implementation research aims to improve the implementation of interventions. Ideally, implementers, beneficiaries, and other stakeholders might desire that the effect of the intervention be available for a long time, so as to maximize the benefit for the community, depending on the type of intervention and the health problem that it addresses. Similarly, the improved practices that result as part of the implementation efforts would also be expected to continue after the study period. Sustainability is the extent to which an evidence-based intervention can deliver its intended benefits over an extended period after external support from the donor agency is terminated. Sustainability can be defined simply as a sustained benefit. It can also be defined as the continued enactment of processes, practices, or work routines that are conveyed and learned through an intervention, which may be necessary to deliver the intended benefits of the intervention over an extended period. In other words, sustainment is one of the aspects needed to achieve sustainability. For example, for there to be sustained benefits from a direct observed therapy program for the treatment of tuberculosis and community-level impact, what we would define as sustainability, services for providing the direct observed therapy have to be maintained for an extended period, and potential beneficiaries have to use those services over that period, which we would call sustainment. The sustainability and sustainment of interventions are influenced by several factors. These include the intervention design and implementation, leadership and the organizational setting of the implementers, and other contextual factors, including community participation and the economic and political situation. Sustainability and sustainment of interventions are central issues in the field of public health. The phenomenon of improvement loss is a common occurrence, observed after the conclusion of a public health project or program. It refers to the significant decrease or loss of improvements in practice and public health impacts that were achieved during the project's duration. Addressing this issue of improvement loss requires proactive and systematic planning right from the outset of the project, emphasizing the importance of sustainability and sustainment of public health interventions. Therefore, it is imperative that implementation research designs employed in public health integrate sustainability and sustainment planning and assessment as integral components. For example, current implementation research in Kulon Progo District, Yogyakarta Province, Indonesia, assesses the sustainability of the Zero TB project, a pilot of comprehensive screening of TB and provision of TB preventive treatment. The project has shown promising effectiveness after 3 years of implementation. The implementation research uses a framework to assess the potential facilitators and barriers to sustainability. The findings can be used to facilitate the process of integration of the Zero TB project into the national TB program. Let's continue looking at systematic approaches for integrating sustainability or sustainment concepts into implementation design. There are several approaches to integrating sustainability and sustainment into implementation research designs. In this chapter, we describe 2 systematic approaches. Firstly, the implementation research design should incorporate sustainability sustainment frameworks, especially for planning and designing an implementation research project. Sustainability frameworks include ExpandNet Framework. Reach, effectiveness, adoption, implementation, maintenance, re-aim. Program Sustainability Assessment Tool, SAT. Consolidated Framework for Sustainability. Sustainability of Public Health Interventions. And Capacity for Sustainability Framework. The ExpandNet framework includes innovation, user organization, environment, resource team or organization, and scaling up strategy domains. This framework is used for the design, development, implementation, and evaluation of public health interventions. Re-aim includes reach, effectiveness, adoption, implementation maintenance, and the design is used for assessment. The Program Sustainability Assessment Tool, SAT, includes the following domains: political support, funding stability, partnership, organizational capacity, program evaluation, program adaptation, communications, and strategic planning, and is used for assessment. The Consolidated Framework for Sustainability constructs in healthcare, includes the initiative design, negotiating initiative processes, the people involved, resources, the organizational setting, and the external environment. It is used for design, development, implementation, and evaluation of public health interventions. Some frameworks predict sustainability, for example, the one from Whelan et al. This framework can explain certain processes that are essential to predict the level of sustainability or sustainment, including planning for sustainability, gathering the evidence, seeking commitment and support, engagement and partnership, program champions, building capacity, organizational and community, embedding into core policy, evaluation, evolving and adapting, and funding. There is another framework, the Capacity for Sustainability Framework, that can be used for the assessment or process of developing a sustained project or both. The framework consists of the following domains: funding stability, political support, partnership, organizational capacity, program adaptation, program evaluation, communications, public health impacts, and strategic planning. The next approach to address sustainability and sustainment involves assessing the relevant sustainability factors and contextual elements. This assessment should align with the sustainability framework discussed earlier. It's important to recognize that implementation outcomes and hypotheses in sustainability studies may vary depending on the type of intervention being evaluated. These interventions encompass a range of approaches, including those carried out by individual providers, initiatives necessitating coordination among multiple staff members, the introduction of new policies, procedures, and technologies, efforts focused on capacity or infrastructure development, as well as collaborative partnerships formed by coalitions. For the interventions implemented by individual providers, fidelity is a measurement of sustainability at the provider level. The assessment should include the contextual factors of fidelity, including motivation to continue the practice and incentives. For interventions requiring coordination among multiple staff, the sustainability assessment should focus on the efforts of different stakeholders in implementing the interventions, and later, sustainability. In this type of intervention, adoption is the implementation outcome relevant for assessment. In the context of the implementation of new policies, procedures, or technologies, the adoption of the implementers to existing health systems should be the focus of assessment. The assessment should also include the continuous effort to monitor and enforce the implementation of new policies, procedures, or technologies. Similarly, with the implementation of new policies, procedures, or technologies, the assessment of sustainability for the intervention of capacity or infrastructure building should address the sustaining capacity of infrastructure building efforts. The evaluation of political and financial support to the implementing organization should be addressed. If the intervention is collaborative partnerships or coalitions, the sustainability assessment should cover the commitment of the coalition or partnership members to continue working together and funding the activities in the partnership. The assessment should also include the partner's perception of the value of the partnership. In this context, sustainability also includes the potential changes in the broader scale system in the period of 10 to 20 years in advance. Let's look back at what we have learnt in this chapter. Sustainability is the extent to which an evidence-based intervention can deliver its intended benefits over an extended period after external support from the donor agency is terminated. While sustainment is the continued enactment of processes, practices, or work routines that are conveyed and learned through an intervention or sustained use. Improvement loss is a phenomenon that frequently happens after the public health project or program is over, and the improvement in practice and public health impacts made during the project period has significantly diminished or is lost. Implementation research aims to improve the implementation of interventions. Ideally, the effect of the intervention should be available for a long time to maximize the benefit for the community, depending on the type of intervention and the health problem it addresses. To minimize improvement loss, systematic planning for, and assessment of, sustainability, and the sustainment of public health intervention is crucial. That's it for this chapter. Before you go, take a moment to consolidate what you have learnt by putting it into practice. Download this chapter's supporting resource material and complete the activity there. Once you have completed the activity, please join us for Chapter 12, dealing with differences between scale-up research and large-scale implementation research. Thank you for listening. Join us for the next chapter where we will be describing core elements, or effective ingredients, of evidence-informed interventions.